I do believe the knowledge is power, and I do believe that because I've got some knowledge, it is my responsibility to figure out how to create that bridge, how to bring it closer to somebody who hasn't gained that knowledge yet.
Hello and welcome to Self Talk. I'm Rachel Astarte. Today I am very honored to have Dr. Alina Soto, who is a holistic mental health care provider based in Seattle. Dr. Soto, welcome.
Hi, I'm excited to be here. Thank you. Thank you for having me.
It's my great pleasure. I'm actually very excited because this is the first interview I've done on Self Talk. Usually it's just me talking into the microphone. And it's lovely to have someone else to bounce off.
Yeah,
once.
Awesome.
So we're going to talk about the self. We're going to talk about healing and all that good stuff. So let's start with you. How did you get into your field, or what calling did you have to get into this field?
Yeah, so it was a tad bit of a complicated story. So I just kind of went in a zigzag motion, but essentially. So my degrees are naturopathic medicine as well as clinical psychology. And I chose naturopathic medicine because while I was essentially getting my pre-med and just kind of exploring options when it came to the medical field, I realized that there was quite a big separation between what people consider like the mental health care, like sciences and services, and what they consider like more of the physical, like body-based services and healthcare. And it just seems so separate, right? Like if either it was all in your head or it's because you tripped and fell and we need to put a Band-Aid on it, right?
Right.
And I thought, because it made sense, I mean, the brain is a very for realsies and physical part of your body, that it makes more sense to have them much more integrated, right? And so I was trying to look for that. And what ended up happening is I actually ended up going to massage school first. So I've been a LMP for almost a decade now. And so I got a lot of body work under my belt. And one of my first positions there is where I found out about NDs. And that approach seemed much more much closer to what I wanted to create with like my own vision. So it took into account, like lifestyle, and it expanded on the diet and like the energetic body and what was going on with the self. But I didn't feel like we had at the time enough education in the psychological component. So I specifically chose Bastyr University. That's where I went because I had both degrees. You could take that as a dual track to combine it. And so I've combined those two, and that's how I've honed my approach. So I think I'm not quite sure what led me there. I just always knew that I wanted to like smash things together, and I got there.
Yeah, I was going to say you have so many modalities that you work with. I looked at your website, which is beautiful and impressive, and we'll talk about the links when we close here. And of course, I'll post them on the site as well. So you started with massage?
Mm-hmm.
Okay, so the idea originally was helping people feel better through touch. Basic.
Yeah, so I think so. I got a little turned off from med school just because I felt like, from my direct experience, so this was only my experience, when I got to shadow some physicians, it just felt like you showed up to each room, you wrote a script, and you walked out. Mm. And to me, like I really had this calling and drive to do something, right? To do something with my hands, and maybe it's like, maybe I want surgery, maybe I want that, right? But then I thought, I'll try out massage because that's something that's very intimate. You literally have to do things.
Yeah.
I did it to see if it was an avenue that I wanted to do. And it turned out that I loved it, actually. Like being able to, be so present with somebody. Because one of the things that I guess I realized in my journey as a massage therapist is that we don't really know each other's bodies that well.
Yeah.
Like intimate partner, like, we get to know somebody's body in a sexual light, but we never really, like, even platonically or as friends, we never see each other's bodies really, and we never are really like paying attention to them like physically, right? And so to me, that was like a very beautiful moment, and to realize that, yeah, touching can have a lot of healing, you know, because the body itself is also an emotional being. So, which makes sense. I mean, the way our memory works, we also store it in here. It's the mind body, like cognition and memory is very, very corporal. Right. And so I had many experiences where I'd be working on somebody and all of a sudden I get this huge story. Like, and specifically, I don't know, I attracted a lot of people who had trauma stories. And so that's what I actually ended up specializing in.
Mm. Wow. That's, you said such beautiful things there. And I want to go back and collect some of them. The idea of not knowing each other's bodies as human beings. And it's massage is such an intimate way to connect with another human being in a therapeutic way, of course. And, which, yeah, the intimacy of it and the healing, is so vital. But there's also the idea of letting someone you don't know very well into your space, right? Mm-hmm. And you said bringing up the trauma that comes up. So here's someone that you're naked in front of them, right? With a towel draped over your bum. And suddenly all of this trauma or very intimate memory stuff can come up, or just emotion can come up. So I wonder, did that give you this idea, like maybe I can't hold some of these stories and maybe I should get into psychology or learning more about the mind? Or how did that work for you in terms of timing?
Yeah, so that itself didn't actually push me towards wanting to learn more about the mind. That itself just kind of solidified that initial idea that the mental health services and the physical services were two separate, and we weren't making enough connection, right? And I think an example of that's really sticks out in my head, like I have this memory, I did work at a psychiatric hospital for a little bit, and one of the things that popped into my mind was when somebody takes someone's blood pressure or someone's like checking someone, it almost seems like the person, and this once again was my direct experience, isn't very aware of how they're holding someone or like how they're touching someone. I think even just that, like if you're a nurse, you're not expected to rub shoulders, of course, that's silly. But, when you're taking blood pressure or you're checking somebody out, you can have gentle touch. You can have very present touch. You can have very aware touch, right? And understand that this is a person that you're touching, right? Mm-hmm. And that was like most, I think, presented to me when I did clinical massage work. So I would see a lot of post-op, I would see car accidents, all that stuff. And one that really struck me was this young woman who had just gone through a mastectomy. And as I was working with her and helping her, and I actually did a lot of massage around the chest, what she said to me, kind of really touched me, which was that I was the first person in her line of doctors and healthcare providers that had actually touched her nicely.
Wow.
That she felt like she had been a piece of meat this whole time. And then I come in and I'm like, hey, this is your body. Mm. And that, I'm even getting a little emotional now because it was an intense moment. And there were things that I did notice, in our conventional medical field, that sometimes, that presence is lacking, right? Mm-hmm. Whether I fully admit it or not. And true, it's not the person's job to be really there, but it is an opportunity to add that in, right? To be present to the power of touch. And I do know, one of a psychiatrist that I really respect, told me that he watching people become so separate from themselves, or sometimes like as they had really intense diagnoses, like get put in with tubes and wires, and he felt almost like they started losing their dignity. Like he just had to hold their hand.
Mm.
Right. So I've known people who like really have that, are in tune with that.
Yeah.
And I think it's important for that to be more widespread.
Yeah. I completely agree. And it's so interesting because in therapy, you're doing psychotherapy, touch is a no-no, unless it's one of those situations where obviously you get permission, and it would be unethical not to touch a client or a patient if they are in desperate need or going through something where touch would be appropriate. But yeah, that gap between the medical model and the human side of it, of connection. Because you work with so many different modalities, do you feel like, this is like asking you, this is the Sophie's Choice moment of the interview. Do you feel like there's one modality that you most align with?
That is a good question. I hadn't fully thought of it. I think I've been approaching everything as just kind of combining everything together. But if I were to choose, I do craniosacral therapy as its separate thing, because I feel like it really helps, especially with people who have gone through enough trauma, like complex PTSD is a good example. Usually that diagnosis means that you've had a trauma event that was stretched out long enough through periods of development that essentially your entire body is like remembering it, right? You don't really remember specific events like PTSD. You're remembering what it felt like. Mm-hmm. And I find that to be very, very helpful at actually addressing the nervous system, right? Because even in any cases of trauma, you want to affect the nervous system because it's your nervous system that gets stuck in that loop. So I actually really resonate with that. And then as far as the psychotherapy piece, I've kind of just combined everything together, like the Rogerian and the CBT. So my approach is very eclectic. Like I do feel like, it is very, very important to teach. A doctor docere literally means to teach, someone who knows how to teach, right, or can teach. And I do think it's really important that people, feel empowered and gain empowerment through understanding, like, what is normal, what is going on, what do your responses mean, how do emotions work, how is the psychology working of all this. So that is something that really resonates with me, because I like, I do believe the knowledge is power, and I do believe that because I've got some knowledge, it is my responsibility to figure out how to create that bridge, how to bring it closer to somebody who hasn't gained that knowledge yet.
Yeah, beautiful. I guess so we've talked about. I'm sorry.
I said teaching craniosacral. There you go.
Yeah, exactly. So we've talked about mind and body. Does spirit factor into your work?
So for me, yes, and I think, quite honestly, for a long time, I did if you had talked to me like 5 years ago, I probably would have been like, no. I was very resistant to that idea, and it's just because I think I had my own, negative experiences with church-based things, right?
Right.
But now that I've kind of seen past that and just kind of let go of the fact that, spirituality is much more than simply what you follow as a dogma or a religion or anything like that. It's spirituality is something that is yours and always has been yours, right? It's of you. And I do think that there is definitely a spiritual component there. And the more I learn about neuroscience and neurobiology, like, the more I see that a lot of the things that we think of as woo-woo are actually not that woo-woo, right?
Right.
Like the one of my favorite concepts to talk about is like the idea of manifestation, right? Sometimes when we talk about it, it seems very up here, where you just think positive thoughts and somehow, magic happens, right? But there is a psychological process that happens when you put awareness into something, right? Just like when somebody points out a brand to you that you've never seen before, and all of a sudden you see it everywhere, right? Everybody's got that bag. And it's like, yeah, you can guide yourself, so to speak, to notice really specific opportunities. And it's part of, the patterns that we get stuck in too. If you really truly believe that nobody likes you, any sort of negative, response that you get from somebody, you're going to automatically assume they don't like you. And that's what you're going to see.
Mm-hmm. Precisely. I bring the science in when I talk about that. That's physics, right? The idea of superpositioning, right? It's a wave, it's a particle. It's a wave, it's a particle. Depends on how you look at it, right? Or when you're not looking at it, it's both. When you look at it, it's one or the other. And so that's science, right? How we look at the world, how we show up in the world. And I go on a rant usually with my patients about intention and manifestation. So I'm going to do just a minor version of that here, which is, all right. Which is because I get all the, about it. This idea that and I'd love to hear your point about it, your thoughts on this, because I think it would be fascinating. So this idea that what we put out into the universe, and you kind of, this is not going to be visual, but you were looking up in the ethers around you, and we just manifest this stuff, pull it out of the sky. And that's where I get a little itchy, which is, it implies that if we do the right things, good things will happen the universe will gift us with what we have asked for. And if we think poorly or have negative thoughts, then we're bringing negativity to us. And my fundamental issue with that, and I'd like to hear your thoughts, is that means in some way that we are separate from the universe, that the universe ends up being a separate entity that can gift us with this stuff or not, depending on how quote unquote good we are or how well we think or feel. And my feeling is that we are not separate from the universe. So this brings it almost back into science. So you are affecting your life the way that you show up in it.
Mm-hmm. Yeah. And I also like the idea that you're talking about. I also don't like it because it implies that life is binary in a way, right?
Exactly.
There are true good things, and there are these true terrible things or bad or negative things. But, people who experience life, we all have realized that it isn't all black and white like that.
Absolutely. Yeah.
Like, yes, we can have all the good intentions, and sometimes what we end up doing doesn't turn out the way we wanted it to, right? And it's not about sitting there being like, I'm a terrible person, or like sit with all the bad things, but hey, what did we learn from this now, right?
Yeah.
Some situations, whatever you did may have been the best thing possible, right? And in some situations, maybe we should have thought about that one a little bit more, but it doesn't imply that there's always a strict, like, these are terrible things and these are good things. And life itself is so much more complex than that. Yeah. And if you're always that terrified of ever making any sort of mistake or deviating from, what you're doing just to explore something else, then you're not going to see that complexity of life, right? It's like that idea of being constantly hounded with fear that you're going to do something wrong, and that makes a body and a nervous system very stressed.
Sure. And that just shows how it's all tied together. And that, I think, is one of the fascinating things about what you do. And one of the reasons I was so excited to talk to you today is because you are quite literally bringing all these things together in your healing. So since this, we're talking about the self, what does self mean to you? What does it mean? For example, I talk to my patients about building a foundation of self. Mm-hmm. What does that concept of self mean to you?
Yeah, so the concept of self, I think about it as a reflection in a way. Like one of the things that I think I talk about a lot is kind of recognizing ourselves as well as the people that were around us as a system, which means that if we're all gears, right, we use that example, our gear has to maintain its integrity in order to work well with the ones around you. But that also means that everybody else also has to kind of keep their shape and integrity as we're moving forward, right? And so in order to do that, we need to start focusing on, you know, what that integrity means to us, right? And I see the self like as yours, like having a hard time explaining this, like it's yours, it's you. And it's about, the self is about the recognition of your power of choice. Like, yes, we are a part of this big thing, but we also are here to make our own choices, and we have that power. So the self is the recognition of our power of choice. And by doing so, we are acknowledging, you know, ourselves as a person. We're acknowledging ourselves as part of the system. We acknowledge ourselves as feeling, as corporal, as all those things. Because the self is also an acknowledgement. And I think that is necessary in order to acknowledge what is going on around you as well, as far as other people, as far as the environment, of recognizing, like, if I am a self and I have a power of choice, and I know that another person does as well, right? And it exercises that, you know, we have an innate skill of empathy. We do have to learn it. We do have to exercise it. And it helps build that the more you are able to fully be within yourself, right? Because then you have this understanding, like, one of the things I liken it to is you can kind of tell when you're trying to get help from somebody if that person hasn't actually fully studied their material, right? Or actually really understood the concept. You can kind of tell, right? And you can kind of tell that, you know, as mammals, we're intuitive to each other, right? And we can kind of tell when someone hasn't fully experienced something that we have, right? And so the more we are able to recognize the self, the more we can see the self in a person, in a group, in the larger environment.
Right. And I love the metaphor of the system, because we are all interconnected, but it's so vital to develop our individual selves so that we can give back fully to the system. Yeah. Yeah. Fantastic. Who are your heroes or heroines?
My heroes. You know, the very first person that popped into my mind was the psychiatrist that I mentioned. So his name is Dr. Christopher Gross, and he was someone I ended up working with. And I was very much impressed with how present he could be for his patients. It was something that I hadn't fully seen before or experienced before in my own personal experience. And it was, I think that moment was pretty powerful for me when he was telling me the story about how he would hold someone's hand. Because I think for me, it officially clicked that human element of it, right? And I think when we're going through medical school and when we're becoming professionals, I think we're almost like fear-mongered with this idea that we can't really show our humanity, or we can't connect in that way, right? Because that's unethical. That'll lead to terrible problems and all these terrible things. And so for me, I think it was a powerful moment because he was somebody who was really good at what he did, very cerebral, and yet was willing to admit that he was there too. Right? Like he was part of the experience as well. Yeah. Right? Not just the patient experience, it's the doctor's experience. So that was very powerful for me. So for me, he definitely is one of my heroes because it was the first time I'd ever seen that or fully experienced that. And then, I think my heroes are people that are very personal or close to me. The other person I would name is Dr. Mark Groven, who was the first ND I'd ever encountered in my life. And he was the only reason why I was interested in it. He turned me onto it and actually wrote my letter of acceptance. And to this day, my letter of recommendation, to this day, I do think it was his letter that got me.
Nice.
Because I had never, once again, I'd never met anyone, or because I didn't know what an ND was. I just assumed it was some other doctor when I first started working in the clinical practice that I was in as a massage therapist, and had NDs and chiropractors and all and such. And it was amazing to watch him work with his hands on somebody. So I was like, is he like a PT? And then he was prescribing. So I was like, what? And then he could do things like a chiropractor, he was combining everything together. Mm-hmm. And so, which is why I got curious and wanted to talk to him. And he was definitely one of those people as well, like extremely present to his work. And I wanted that. I definitely admired that aspect. So those are right now in my life two of my major heroes.
Yeah. It's beautiful how we carry them with us, and sort of when we do our work, our teachers are so much a part of what we do, and the people who guide us, it's almost like embodying them a little bit when we do. I guess that's the tradition of being taught and being or apprenticing and receiving the gifts that our teachers give us. That's beautiful. So let's talk a couple more questions. Let's talk about 2020 and what it just feels like this year there's been a lot of unrest and a lot of uncertainty. And I wonder if you see this reflected in your patients at all or only.
Yeah. Yeah, I definitely do see this reflected in my patients. And the thing I find fascinating about it, I think we've touched on this earlier, is that everybody seems to believe that we're the only one in this experience. Mm-hmm. Right? Yeah. And it's interesting because the things I'm seeing are common for any mammal that is currently feeling trapped, right? Right. And it's like especially as this kind of got started, every single patient almost told me the same complaints. Right. And so it's fascinating. And it was, I think, a fascinating lesson and really awesome conversation pieces to just talk about that, of being like, that this is a shared experience. Like most of us are feeling real frustrated that we can't go out and play.
Yeah. Yeah.
We're antsy. We're seeing increases in, and it's unfortunate, but we saw increases in self-harm. Mm-hmm. And that makes sense. I mean, you cage up a bird long enough, they will start to self-harm.
Mm-hmm. Yep.
So like it's been fascinating to just kind of talk about that we can have a very large effect on our own communities. And it's not just our experience, it's everyone's experience.
Mm-hmm. And at the same time, it's very unique to each individual, as we were saying earlier about the system. It's like, but I'm dealing with it. Yeah, I know my neighbors are dealing with it too, but I'm dealing with it. How do you work with patients who maybe they get that cerebrally, but they are still suffering?
Yeah, so it's about going with the individual and figuring out what helped you in the past, what has worked for you. Because we're all going through this together, but we all have different forms of play, right? Like mine is dance, other people were concerts and things like that. Some were like dining with friends, some were having big, family dinners. Mm-hmm. So it is about, figuring out that individual story, and also recognizing that, just like I'm frustrated because I can't do dance. So is the other person next to me, and it is a shared experience, and yet I know that I can make steps towards balancing that within myself.
Mm-hmm. Right.
Like I know that by figuring out what dance brought to me and figuring out what I essentially used it for, I can learn to bring that to myself in other ways, even though I'm in a more restricted time, right? And so I think that, that is really important, not to just dismiss.
Yeah.
Like, well, everybody else thinks this sucks,
Right. Yeah. I mean, there's also, it's forcing us to look at things differently and to actually become okay with uncertainty, which we've always had. It's just been put right in our face instead. So you actually helped me, beautiful segue into the final question, which was, for yourself, what do you do to stay grounded, to stay joyful, to stay balanced? And you said dance. What kind of dance do you?
So I did a lot of partner dancing, like before the pandemic. I was definitely big on fusion. There's a big fusion community here in Seattle. And so that was like my thing, like being able to do really close dances. Like there's a type of dance called microfusion, and micro dancing is like really, really close. Like you're literally touching head to head, cheek to cheek, like chest to chest. And that to me was always like this huge, like wonderful, like soul connection. Like I really felt resonant when I got to do that. And then it went away. And unfortunately it's one of the communities that may take a long time to bounce back, right? Because of how we've been disrupted. But for me, it was basically starting to take this as an opportunity to see myself when everything is gone, right? What do I have left? Got my daughter. And one of the main things that, was really important to me prior to having my daughter was that I really wanted to learn how to build myself up to be a very present parent. That was actually one of my main goals. I was able to do that, like slightly prior to pandemic. She was born in January.
Oh, wow.
So, I had a baby during this, which was actually
congratulations.
Because at one point in time, I couldn't go back to work anyway if I felt like it, right? So I got to spend a lot of time with my baby, and it was, I saw that personally as a gift because that's what I wanted. I constructed my own business in a way that, from 7 to 2, I'm working, and my partner gets to take care of her, and then I switch over. And so she's always with one of us. So we are there. We are present to her life, which I love. And this is what we created and what we wanted to create. And actually having the pandemic allowed me to figure that out more. Like, this is what I wanted. I want to be here. And so for me, it's about recognizing that even though right now I'm limited, I get to figure out, like I mentioned before, what is it that I was trying to do to begin with? And do I still have it? And it's like, I do. I haven't really, my entire being has not been destroyed because I don't have dance, I just lost a tool.
Right.
But I can create that resonance and that connection in a different way. Right. So for me, actually, I've felt pretty good throughout this, just being able to see it as an opportunity to really hone in on my family and the values that I had and still have as being a parent. And I also, like, a lot of life changes. I also just recently moved into a house, recently purchased one, moved in. And so it was awesome to think about that too. Like it gave me an opportunity to really hone in on that home aspect. And so I'm building my home, and dance will come again someday. And then
of course it will. Of course it has to.
It has to. It will.
What a beautiful, I'd never heard of microfusion. That's fantastic. Mm-hmm. I love the concept of it. And congratulations on the birth of your daughter and your home ownership. And that's wonderful. You've got a lot on your plate, so you're good. So that's 2021 for you, unrolling. So as we close out, I wonder if you might share with the listeners how they can get in touch with you. Or if you have anything you'd like to, if you have any books or any appearances you'd like to share.
Yeah, so everything is fully automated on my website. So if you want to reach out to me or even book an appointment, I do offer free consultations. I'm happy to do free 15-minute to 20-minute check-ins just to chat to see if I'd be a good fit for you. So my website is www.terradusa.com.
Can you spell that?
Yes, so
ERA?
TerraDusa.
Okay, TERRA. Okay.
Yep.
Okay, got it. So yes. I'm also going to post it. You know, we'll have the actual link at the bottom of the site as well, at my site. Dr. Soto, thank you for being part of Self Talk. It's been a pleasure talking with you. And I just want everyone, I want everyone to know that this is how you can get in touch with them, which is terradusa.com, and we'll have the link. Anything else that you'd like to say? Any final words or thoughts that you'd like to share? This will be 2021. So we're recording this and we're posting it in the future. So what are your words of advice for all of us?
Oh, the words of advice. I do like to say this a lot. If you've directly have made a choice to do something different, trust that you will, because it will happen.
Beautiful. Beautiful. That's a lovely way to end. Okay, so thank you so much, Dr. Soto. And again, you can get in touch with them on the website, which I will put the link below. And thanks again.
Yeah, thank you so much for having me. This is great.